Good afternoon. I have the pleasure of introducing Brian Weiderman this afternoon. He's the clinical chemistry supervisor at Irwin Army Community Hospital in Fort Riley, Kansas. As the department supervisor, Brian is responsible for oversight of 93 diagnostic test offerings and 6,000 quality tests per month. Recently, Brian has conducted CAP inspections at hospitals in the United States. Previously, Brian has served as a laboratory generalist for 7 years and a veterinary technician for 7 years, standing up a diagnostic testing program at an accredited veterinary hospital. Brian is a Kansas State University alumni, holding academic achievements including an associate's in medical laboratory technology, a bachelor's of science in biology, and a master of healthcare administration. Brian is currently pursuing a master of public health and infectious disease and zoonoses, expected to complete in fall 2025 at Kansas State University. In addition to academic qualifications, Brian is certified as an MLS through AMT and a Six Sigma Black Belt.
All right, good evening. I guess I'll be closing out this conference. And we'll be talking today about general clinical lab safety and other information about clinical laboratories. As the introduction said, I am Brian Weiderman. I was working in a veterinary hospital for 7 years. I transferred over to the human clinical laboratory where I've been working for over 8 years now. I've become the clinical supervisor. As far as education, I did get my MLT through Manhattan Area Technical College. I did get a bachelor's in biology through Kansas State University. I do hold a minor in animal science. I did get a master's of healthcare administration through Central Michigan, and I am currently a student again at K-State going for infectious disease through the Master of Public Health program. So to start things off, what is a diagnostic laboratory? Why is it important? It's said that over 85% of all medical decisions play a part using medical laboratory results. By having safety in the laboratory and quality assurance purposes, we're able to ensure that results in medical laboratory are accurate, and it also protects both the patients and the staff. We like to say safety in the laboratory means quality results. So for topics today, we'll go over accreditation and regulatory agencies, specific regulations, hazards you'll find in the laboratory, how to protect yourself, what equipment maintenance means, retraining requirements, and quality assurance. So regulatory agencies for a clinical laboratory, there are a few of them. The main one now is going to be CLIA. All diagnostic laboratories will have to have some sort of CLIA CLIA certificate. CLIA does set the minimum standard for all diagnostic laboratories. There are other agencies that can have stricter requirements, but CLIA is going to be our standard. The FDA is going to be there to ensure that laboratory equipment is developed correctly and in accordance to what we need, and will ensure a safety environment for the laboratory. OSHA is going to be a big part of the laboratory, as we're going to follow the safety standards to make sure that our patients and our staff get taken care of and can do testing safely. And then we also have the CDC, which will set our guidelines for infectious disease prevention and prevent transmission between people. So all diagnostic laboratories that do certify human results will need some kind of CLIA certificate, whether they're using wave testing or more complex testing. There are different levels of CLIA certificates. The first level is going to be our CLIA waived certificate, our certificate of waiver. That is going to be for laboratories that are just doing very basic testing that anybody can do. What a wave test means, those are tests that are almost impossible to mess up unless you do something bad. But that anybody that can follow simple directions should be able to do those tests. The next certificate is the provider perform microscopy certificate. A lot of people are interested to find out that a doctor can't just go and do a laboratory test. We don't play like Dr. House does. Even doctors are required in where they work to have some kind of certificate to do any type of laboratory testing. And even then they are limited as to what they're allowed to do. But that is the second type of certificate. In our third type, we have the certificate of registration. That just means that a laboratory has done the paperwork to get registered and certified for a moderate to high complexity testing. They are going to be required to do a inspection of their laboratory and make sure that they have the procedures in place. But they are allowed to start testing once they have registered for that. A certificate of compliance means that a laboratory is allowed to do moderate to high complexity testing based on inspections through the CMS or CLIA themselves. And then a certificate of accreditation, that is going to be your highest standard for accreditation of certificates. That means an actual accreditation agency has come out, inspected a laboratory and said they are ready to perform testing at a high level. CLIA does recognize 7 agencies for accreditation and allows them to do the inspections. The first one is going to be our ABB. They recently changed their names. Currently, they're the Association for Advancement of Blood and Biotherapies. You may know them as the American Association of Blood Banking. They changed their name back in 2021. They're going to be covering your compliance with blood collections, blood transfusions, and they're going to be the ones that are doing the compliance for blood regulation and blood safety. Next one, there's going to be the A2LA, or the American Association for Laboratory Accreditation. That laboratory, sorry, they're going to be the ones that are more for international laboratories, but they're really focused on quality management and technical competencies. Next, we have the AHHS, or the Accreditation Associations for Hospitals and Healthcare Systems. That is a full hospital accreditation practice. It's just one of the ones that you can choose from. They do a big focus on safety. Next one is the ASHI, or the American Associates of Histocompatibility and Immunogenetics. Those are 4 laboratories that are doing organ transplants and really need to do that compatibility testing. 5th, we have COLA. A lot of your doctor's offices are going to be accredited through COLA. They're really focused on smaller laboratories and smaller physicians. Then the most recognized one and the highest standard is going to be your CAP accreditation. They're going to be the ones that have over 1,500 actual compliance checklist items. That'll be focused on anywhere from safety to quality control, proficiency testing, and accuracy of all results. The CAP and all of these will require inspections every 2 years. And then finally, we have the Joint Commission. A lot of hospitals are going to be focused on the Joint Commission as it is a full hospital accreditation practice. The laboratory is going to be just a part of their accreditation. But anybody that is doing diagnostic testing will want to eventually go through one of these 7 agencies that are accepted by CLIA. All right. So as far as diagnostic professionals in the laboratory, at the top of the chain, you'll find a pathologist who's usually going to be a medical director, or they could just be one of the associate pathologists in the laboratory. They're going to be the ones making all the final decisions. They're going to be the ones making sure that their name is all on all the paperwork and they approve everything that the laboratory does. Underneath them, there's going to be the MLSs like myself, who are going to be doing the laboratory testing, setting up all of the groundwork, making sure everything's in compliance, doing the daily quality controls, and doing all the testing to make sure that the hospital or any healthcare organization has the testing that they need. Next are the MLTs that are going to be working underneath an MLS. They are mostly going to be doing a lot of the same jobs as the MLS. They just won't be putting their names off of anything or signing off on any type of validations or certifications. Underneath them, we'll have phlebotomists and lab assistants. They're the ones that are going to be drawing your samples. They're going to be the face of the laboratory as far as people interaction. And then MLSs and MLTs and phlebotomists, they can be certified through multiple organizations, ASCP, AMT, and then there's AABB as well. These laboratory professionals, they're not always required to be certified. It is harder to find a job without doing so. And a majority of laboratory professionals will be recertified every 3 years, 2 to 3 years. The different sections of the laboratory. So all MLTs and MLSs should be certified to run all of these. However, most of them, or a lot of them, will go into a specific area, at least for a while. Myself, I run the chemistry section, but I was a generalist for quite some time before that. The other areas of the laboratory, there's going to be urinalysis, which is dealing with specifically what is in people's urine, whether they have a urinary tract infection, or whether they have kidney issues, or any other types of problems, even including parasites. Hematology, those are going to be the people that are looking at your red and white blood cells. They will be checking to see if you have parasites in your blood too, or if you are in need of a blood transfusion. Serology, those are the people that are going to be doing specific testing as far as do you have mono, do you have flu, HIV, any of the specific pathogen testing. There's general pathology. A lot of that is going to be where the pathologist works. Any issues with high complexity tests are going to be looked at through there. Coagulation studies, if you have problems with bleeding, or you can't, or if you notice that you take a long time to clot, they're going to be the ones that you're going to go to. Immunohematology or blood banking, if you need a transfusion, they're going to be the ones that are going to do the compatibility testing, make sure that you know what, make sure you're doing that as safely as possible. Microbiology, if you have an infection, they're going to be the ones to find the infection, tell you what type of infection it is, and they're going to tell you which type of antibiotics are available for you to use. And then finally, point of care. A lot of point of care is going to be your wave testing that anybody, including nurses, can do. And a lot of the point of care is going to be performed bedside. But even if they are performed away from the laboratory, they do fall under the laboratory itself. Onto standards. So OSHA is one of the agencies that we were looking at, and they have a comprehensive bloodborne pathogen standard. So we're going to go over that right now. First part of that is going to be our exposure control plans. OSHA does require that all laboratories have an exposure control plan that is written down. This will identify any tasks or jobs or anybody that can potentially have exposure with any type of bloodborne pathogen. With that, you must have a way to identify the risks, what you're going to do if an exposure does happen, and you're going to have a way to report those issues. This plan must be updated or checked annually. And it does require that employers maintain a log of all injuries that have happened. OSHA does require protective measures. So when we're talking about protective measures, we're going to have universal precautions. That basically means that we're going to treat all samples as infectious, all areas of the laboratory as infectious, whether we know that or not. So to prevent ourselves from getting sick, we're going to be making sure we cover up. The standards do require over 80% of our body is covered with protective equipment, at least in a medical laboratory. We're going to be using gloves when we're actually touching any areas that could be infected, including our blood samples or infectious material. We do wear face protection, and we can use respiratory protection whenever there is a possibility of aerosols or droplets. Our universal precautions also do mandate that we use gloves and properly don and doff the gloves to prevent any cross contamination. And we wash our hands immediately after our gloves are taken off. And then we must handle any sharps with safety measures in place. The PPE must be provided to the employee by the employer at no cost. We must be, the protective measures also include engineering controls. This can be anything from preventing us from recapping needles, or using the proper disposal for sharps and sharps containers. OSHA also does require regulatory waste management. We have to be using the correct containers to regulate medical waste or bloodborne pathogens. They must be labeled correctly. And they have strict standards of how to ship any of those materials. For employee protection, all employees that are handling potentially infectious material, the employer is required to offer the employee the hepatitis B vaccination. Hepatitis B is a virus that is fairly easily transmittable, either through needle sticks or any contact with hazardous material. The employee does not have to, this is an important point, the employee does not have to take the vaccine. They can sign a waiver against it, but it is the employer's responsibility to at least offer it to the employee. And the employer should be training all the employees about all risks of handling infectious materials, bloodborne pathogens. Those risks, especially for hepatitis, do include a possibility of both long-term and short-term damage. While there are people that can be there are people that can recover from hepatitis B. It can also become a long-term chronic condition that never goes away. And employers are required to let the employee know about that. And as the last regulation, employers do require training of all safety measures for the employee. They have to keep the employee's name, dates, and everything that they've been trained on specifically. And those records must be kept for at least 3 years from when they were trained. And they are required to do annual training on that. OSHA does also require labeling of all dangerous material. And it is the employee's right to know about that type of labeling. So in the photo there, you can see all the different labels that can be used. So each of these pictures do represent a different type of hazard that you can find in the laboratory. OSHA does require safety data sheets for all chemicals that are stored in the laboratory. Those chemicals must be kept for multiple years after an employee has left the facility. And that includes all chemicals that an employee may have come in contact with during their time at the employer's area. What I mean is, if on my first day, there's a cleaning solution that I came in contact with, the employee must keep the safety data sheet on that chemical until after I have left the facility, even if we have stopped using that chemical. And of course, with this, the employer does require training on all of these. OSHA does have specific laboratory standards. They do require that laboratories monitor exposure to chemicals and make sure that no employee goes over specifically set limits. They do require that laboratories have a chemical hygiene plan before any employee comes in contact with potentially infectious material. They do require that any employees that are handling chemically hazardous material in their workplace have specific training about not only the risks of that chemical material, but any protective PPE that they might require. Should an employee get injured by any means, it is the employer's responsibility to allow the employee to have medical consultations or any exams upon request. And then OSHA does require, again, chemical labeling. Even if you have a bottle of water sitting on your counter, that has to be labeled as water and when that bottle was filled. And again, OSHA does require the employer to keep records of everything that's listed here. So as far as hazards, you might find in the chemical laboratory or clinical laboratory, you can find biological hazards. That is your bloodborne pathogens, infections, even potentially mucus, whatever you might, whatever comes out of your body would be considered a biological hazard. There are chemical hazards. As with all laboratories, there are going to be acids, bases, or any other toxic materials. There are physical hazards, including needles, broken bottles, electrical hazards, including any equipment that we use in the laboratory. A lot of it is high voltage. Ergonomic hazards. A lot of the work that are done by laboratory professionals are unfortunately repetitive tasks. So it is part of the employer's responsibility to minimize those. They can do that by allowing the employees to use standing desks. They have specific masks to make standing easier. They should make sure that all employees are following proper procedure as far as sitting down, lifting chemicals, and making sure they have the correct computers that they need to prevent damage. And there's waste hazards, which can be anything from chemical waste to any waste coming off the analyzers or just waste from your bloodbornes. In order to help prevent any dangers or safety issues, laboratories do require engineering controls set by OSHA. These can be anything from biosafety cabinets to fume hoods to ventilation systems. They can be making sure that the equipment is functional as far as locking and all the safety features that are on any equipment to be working. It can mean that we're using specific automated equipment instead of doing manual testing. We should be using chemical storage cabinets and flame storage cabinets for anything that could be intentionally that could be caught on fire. And then finally, we should be using sharp containers correctly. And all of those should be labeled and maintained correctly with maintenance records. Administrative controls. One thing we like to say in the laboratory is if something went wrong or somebody actually had an injury, it's probably because they weren't following procedure. With that said, all laboratories are required to have an SOP or a standard operating procedure for all testing or all tasks in the laboratory specifically. Where they should provide the employees with training. Not only should the employees be comfortable with all of their tasks that they're doing, the employer should be comfortable assigning each task to the employee and making sure that they actually know what they're doing. All laboratory staff do require a continual education to make sure they're caught up with not only their skills, but their knowledge of laboratory practices. Employers should help make sure that the employees have the education that they need. The employers or laboratories should have controls in place to prevent any injuries. These can be physical controls, or they can be technical controls. Again, OSHA does require all laboratories to have some type of reporting mechanism in case an injury or a potential injury happens. All laboratories should be doing a risk assessment. They should be following their samples that they receive from start to finish to see if there's any potential ways that an employee can get hurt from those, and making sure that we have plans in place to mitigate those risks. One thing that's missed a lot, laboratories do require proper housekeeping. It is possible that especially with all the machinery in the laboratory can get dusty and dirty. And that is unfortunately a potential to cause harm to our laboratory testing in patients. So housekeeping is a must with the laboratory. That can be anything from making sure a table is organized, our reagents are organized, or it could just mean that there's even dust on the counter. All equipment and testing do require calibration and maintenance before they are used for patient testing. And in case something does happen, an employer should have an emergency response and downtime plans. As we know, anything that can happen will happen. So laboratory professionals should be trained on all types of personal protective equipment. Not everything will be needed for all types of laboratory testing, but they should know which type of PPE is required for each type of testing. And remember, we should be doing universal precautions. So if it is possible that a sample has some kind of biological hazard in it, we should assume that it does and wear the proper protective equipment for that. So some of the types of gear that laboratory personnel should have. One, anytime you're handling samples, you should be wearing lab coats and lab gloves. You should have long pants on and having closed-toe shoes. And that's just the basics of all laboratories. And depending on what you're working with, you might be required to have headgear. You might be required to have face shields or goggles. And you may have to have be working in a biosafety cabinet or have specific resistant clothing, including chemical resistant aprons or chemically resistant gloves. One thing that's not on there that we also do have, we do work with dry ice a lot. So there are specific gloves to handle the cold temperatures that you can be found in the laboratory as well. But all laboratory staff do need to be trained on each of these types of PPE. That includes the correct techniques for putting the protective equipment on and off without spreading any infectious material. Hand washing also, again, it's critical. After you've taken off any of your protective equipment, it should be standard that all employees wash their hands after taking those off. Hand sanitizers are not a solution for that or a substitute for that. And while PPE is important, it's also important to remember that that is the last line of defense and it's not the first line of defense. Following proper procedure and having good hygiene are the main things that we need to do. So these are the hierarchy of controls. Again, the PPE is our last line of defense. And that's when no other things can be done. On the top of our controls, we should be doing those hazard assessments in all of our laboratories. And if there is a hazard that is identified that can be removed, that is the first line of defense. We should be removing as many hazards as possible. And then by accreditation standards, laboratories should be doing those risk assessments quarterly. If we can't remove a hazard or completely eliminate what's causing the hazard, our next line of defense is finding a different way around the task that hazard has had. But if we can't remove or replace the hazard, next step is our engineering controls, making sure that we are seeing if we're able to isolate our employees away from those hazards, so they don't have to come in direct contact. And even if we can't completely eliminate that, we should at least minimize the amount of employees that come in contact with those. And so the next step would be the administrative controls, finding ways to reduce any contact with exposure to limit exposure to infectious material. And again, our last line of defense is going to be our personal protective equipment. That's why the PPE is so important, is because once that final barrier is breached, that's when people get hurt. All right. And so we listed the types of hazards. So our first type of hazard was the biological hazards. Ways to plan against biological hazards. First, we need to have a good inventory system so that way we know which types of hazards that we have. This includes sample tracking or an actual inventory system. We need to be able to properly dispose of biological material, whether that's through autoclaving or through biological waste. We need to have a way to minimize aerosols because aerosols can be formed through using centrifuges, through pipetting or vortexing samples. And if we are vortexing samples, one of those times that comes to mind when COVID first hit, the very first samples required us to vortex samples that had actual COVID in it with the reagent material. And so we had to wear those N95s to prevent ourselves from getting sick by those aerosols. A good way also to prevent ourselves from having aerosol contamination is by using biosafety cabinets properly. Now, if we are using biosafety cabinets, we do need to make sure that those are actually getting maintained properly. They should be being checked every single year to make sure that they are functioning correctly. And if you don't know what a biosafety cabinet is, that is a cabinet that has consistent airflow at a specific velocity. It uses a HEPA air filter, and so it's filtering in the air as we're working inside the hood. And that should not be confused with a fume hood, as they're not the same thing. Fume hoods will not protect you against these types of aerosols. Right. We do require chemical safety. Again, this is a lot of labeling, making sure anything that's opened is labeled properly. Again, even if it's water, it needs to be labeled as to what it is, what grade of water it is, when it was opened, ideally when it expires, and again, ideally who opened that. We do need to have a correct inventory control system so that chemicals aren't just thrown everywhere. And we do need to make sure we know with the pipette tips that we use with chemicals, they cannot be disposed of in a biohazard container that uses soft-walled bags, as those pipette tips can puncture those bags and cause a safety issue. All equipment and tests in the laboratory need to have the calibrations and maintenance records performed. This equipment includes anything from our timers to our thermometers, our centrifuges, or just our actual testing equipment. Our timers should be checked yearly to make sure that they're accurate, as well as our thermometers should be checked against the standard. Any weight scales that we use should be checked daily before we use them to make sure that they're still weighing properly. With CLIA, any equipment that we use for clinical laboratory testing should be recalibrated every 6 months or whenever there's a new lot in place. The maintenance standards. Maintenance can be anything from cleaning the equipment to replacing disposable equipment or disposable parts of the equipment. The maintenance will be set by the manufacturer. Any laboratory can set more stringent maintenance cycles than the manufacturer, but they cannot set less. So whenever you get a new piece of equipment or a new test, you should be looking at the package insert that the manufacturer provides for you, and going ahead and making sure you're at least following their directions. With CLIA standards, we should be keeping logs for all of our calibrations and maintenance. And by standard, those logs need to be kept for 2 years. If we are using water or water baths for any reason in our laboratory, we should be making sure we're cleaning those out, and any water that is used for diagnostic testing needs to be tested for bacterial contamination at least monthly. All right. So any diagnostic tests that are done in the laboratory needs to have quality control in place. That means before we do any testing or release any specific results, we're going to be running a standardized sample and that has a known range or acceptable limit. And then making sure that those samples, when tested on our analyzer or whatever we're trying to test, that known sample falls in those limits. By CLIA standards, we should be checking that every single day of testing. And we should be checking 2 levels. A lot of people will use quality assurance and quality control to mean the same thing. But quality control is actually just a part of quality assurance. As quality assurance means the overall quality control, quality plan of your laboratory. And per CLIA requirements, as long as you have a certificate through them, you are required to do proficiency testing, which means you'll have a sample mailed to you. It's usually going to be twice a year. And then you're going to test that that sample that was mailed to you in the same way that you would test any patient. And this should be done on every single test that you run in your laboratory. All laboratories should have safety standards or sharps procedures. You should have a way to correctly dispose of sharps. Some of the issues we've seen with sharps containers, they should not be above your eye level. So if you have to reach upward and down into them, that is not installed correctly. All sharps containers should have locking lids that will stay in place when it's not used in case it ever gets tipped over. A laboratory, when they're using needles, they should have a way for an employee to cap or dispose of needles properly without having to recap them. A lot of new needles and syringe containers have ways to hide those needles before they can be disposed of. If for some reason sharps are reused, they do need to be disinfected in an autoclave before they are reused. Again, an employee does need to keep records of all injuries with sharps. A laboratory's emergency procedures do need to include all types of procedures. That includes what to do if there is a chemical spill, what to do if there is a fire. They should have a emergency fire exit plan. They do need to know what to do if there's a chemical exposure or any other type of emergency, including gas leaks, electrical issues, or any type of downtime. Their incident reporting should include every single type of hazard mentioned there. And then finally, laboratories are required to have emergency equipment on hand. That includes fire extinguishers, first aid kits, and chemical spill kits. These should be fire extinguishers should be tested or checked every 6 months to make sure they are functioning properly. First aid kits should be checked every 6 months to make sure that they have not expired and they have all the equipment still in them. And then spill kits should be checked frequently to make sure that they also are not expired. And not everything in the spill kit will have an expiration date, but a lot of people will forget to check those as chemical spills luckily don't happen that often. All right, laboratories are required to have at least eye wash stations. And if they have showers, they are required to check those showers to make sure they're working properly as well. Any laboratory personnel can do this. They don't have to be done through inspection, but they do need to be checked weekly to make sure that they're flowing correctly. They should be checked by allowing the water to flow for 15 minutes. The laboratory is required to document that the temperature is correct coming out of those eye washes. And if the eye wash station has a flap on it, the water pressure needs to be high enough to where it opens those flaps up themselves. If during the weekly checks, the laboratory notices that the flaps stay down, they should be calling to get that fixed. And through standards, there shouldn't be nothing in the path to get to each of those eye wash stations. And of course, laboratories are required to have cybersecurity and HIPAA compliance. It is said that this year, hospitals throughout the United States will face over $10 billion in damage from cybersecurity issues. And potentially within the next 5 years, that number will rise to over $100 billion. And so we do need to be having ways to prevent those cybersecurity issues as soon as possible. So we do need a plan to not only prevent cybersecurity issues, but we should have a plan to know what to do if a cyber event does happen. By HIPAA regulation, laboratories are required to try and prevent any release of patient information. This could be through physical measures, and it can be through technical measures, and through training. By best policy, any laboratory information systems should require dual factor identification to log in. Ideally, they should require a security badge and a unique ID. All data on the hospital laboratory or on a clinical laboratory's site should be encrypted and protected from the outside. A laboratory should have a routine audit to check to see if anybody is accessing patient information that they should not be accessing. And all employees that handle sensitive information should be getting training on the different types of threats out there, whether it's phasing, malware, insider threats, or just simple emails that look like company emails, but are trying to steal information. All right, so we've mentioned before, laboratories are required to train all of their staff. What does training mean? Well, through CLIA standards, we're going to require initial training of all staff. Again, the employee and employer should feel confident that the employee knows what they're doing, and they should both sign off on the employee originally. They should be then doing training again at 6 months, and then at a year, and then every year after. The big thing is when it comes to employee training, it is a continuous process. It's not a one and done thing. So if you look at the training cycle, we'll identify training needs, design the training, deliver it, and evaluate what extra training is needed, and we'll repeat that cycle. All right, so it is recommended that the laboratories will go through audits. They should be checking their own laboratories through their own self-inspection checklists to make sure that they're following their own procedure. And then CLIA does require outside inspections of all laboratories for clinical laboratories. If a laboratory is for forensic use only, they can get around doing inspections, but anyone that is doing diagnostic work should have an inspection. It is recommended that even with training, that laboratories keep daily checklists for every instrument, every task that any employee needs to do to make sure that those tasks do get done, and we have records of those. Accreditation does also, the accreditation agencies do also require that employees not only have safety plans, but they actually have safety, quarterly safety checks to make sure that everything is going according to the plans that they were created. And one important thing that is taught is that when we're talking about reporting systems, we need to make sure that those reporting systems are not a punitive thing. They are created to be sure that employees feel safe to speak up and they don't get punished for speaking up. If we do see an issue, a safety issue through any employees specifically, we should be checking to make sure our policy first off is working correctly or is written correctly. But once that is checked, if we are still having issues, we need to make sure we're actually retraining all of our employees, not just in our yearly checks, but anytime it's actually needed. All right. All right. Well, I do appreciate everybody coming. And again, remember, anytime we're doing safe laboratory practices, that means we're doing quality results. If anybody has questions, you can ask, but otherwise.